Ebola is a virus that's been studied, but clearly there's more stuff that we're learning about it daily. What are some of the unknowns about Ebola that you would like to know that might in fact impact on the safety of Americans?
That's a very difficult question to answer. I would like to know what efforts are truly being done to standardize and make uniform individual hospital responses. I think in the East Coast here, unless and until we stop these flights from Africa, we are kidding ourselves unless they take maximal efforts to prevent the healthcare workers. There are already nurses that are saying, the nurses union came out and said that we shouldn't be taking care of these patients in New Jersey. I think that, that's inflammatory. I can understand the emotion that goes into that, but you can't tell me that we cannot be prepared in our own state for an isolated case here or there. There are plenty of resources from, CDC in particular and the NIH and our taxes at work. We have to hope that those experts are going to step up and do the right thing at a time when we need them most.
I just recall my practice back in the early days of the AIDS epidemic. There are eerie echoes here from the early 80s. I mean, I heard the same thing in hospital lounges and in doctors' call rooms. There were doctors on television saying, this AIDS is deadly. I'm not going to touch anybody with it. To me, that was always antithetical to the calling of the profession. And it's directly opposed to what these two brave nurses decided to do in Dallas. We have a choice here, don't we?
Indeed we do, and I share your feelings in that regard. Obviously, I took care of, and still do, take care of a number of HIV patients. And as an intern in Newark in 1985 at St. Michael's Medical Center, we had our share of HIV where interns and residents knew more about that disease than most of the nation's practicing physicians. And we learned in a hurry that you better learn all you can about this illness. These people are younger than you. As a resident and as an intern, they were younger than you and dying left and right. It was horrible. But we knew enough at the time even that it wasn't spread through bodily secretions such as sweat or saliva or even vomit.
Ebola is different.
Ebola is very different, and I think it's quite a bit more contagious.
It's scarier.